Hi, my name is Kate Boddy. I'm hearing, I'm a British Sign Language interpreter, and most of my family are profoundly deaf. And our family just wanted to share our experiences of DA languages and what their provision is like. I live in the area of Merseyside, and we are very fortunate that most of the hospitals and walk-in centres and so on have now contracted to specialist deaf agencies, which means that our service provision has improved massively. Prior to the changes in contracting, DA languages held most of the contacts in our area, and I want to give you some feedback about what our experiences were like. So some time ago, my father was poorly and he wanted to attend the walk-in centre. He was on the way and texted me to say he was attending. I was in work, and at that time, many families knew that service provision was really poor. So if you wanted an interpreter, you had to organise it yourself. So I made contact with a number of interpreters in the local area. One came forward and said that she was available, and I asked her if she was registered with DA Languages, and she confirmed that she was. So I phoned the walk-in centre, let them know my father was on the way, and asked them to start the process of booking an interpreter. At the same time, I made a phone call to DA Languages and said, my dad's on the way to the walk-in centre. There's an interpreter available. She's registered with you. This is her name. Please, can you make contact with the hospital and start that process? And I was told no. When I asked why, because obviously if my father arrived at the hospital without any communication support, it posed a risk. And they told me they weren't allowed to contact the hospital. And I said, well, please, can you just at least make a note of the name of the interpreter who said they're available? And when the hospital do contact you, you can contact her to book. And the work's already been done for you. And again, they were just said no. It was a really difficult conversation. In the end, as that interaction went on, the walk-in centre never booked an interpreter. It was really complicated. And as a result, my dad had to go to the hospital, have more tests and so on. He then had a follow-up appointment, and that appointment was on a particular day. And within that day, there was two different appointments, one for testing and one for a consultation in the afternoon to explain his results. As that appointment date was drawing near, we'd already submitted a complaint to the hospital. They were already aware, DA Languages were aware of this appointment date. This date was coming closer and we hadn't heard anything. My father was becoming quite anxious because obviously he wanted to know what was happening. Did he need to bring a family member with him to that appointment or what? So I called DA Languages, and again, they were being really difficult, wouldn't give me any information. But you could kind of tell from what they were saying that no interpreters had been booked. So I said, please, can you sort it out? And they were saying, well, we'll try. And the family just knew from what our previous experiences, we wouldn't get an interpreter. So we contacted a specialist deaf agency and asked them to make sure an interpreter was made available, and they booked somebody straight away. So again, here we see the differences. DA Languages were saying they couldn't, and a specialist deaf agency booked somebody straight away. The service provision was very different. Also, with the specialist deaf agency, my father could make contact with them directly. DA Languages didn't have any way for a deaf person, a BSL user, to make contact with them. So again, had to rely on family members. I've been emailing DA Languages and they weren't responding, and the deaf agency was always responsive straight away. So again, there was clear difference in that service provision. We made a formal complaint to the hospital, and they said that they would make changes, but they never did, not in time anyway. More recently, my father was terminal and he had an inpatient stay at the hospital, and he was really poorly at the time. And again, I contacted DA Languages and said, please, can you start the process of booking an interpreter? And again, they refused. They refused to book an interpreter and cited that the hospital had to make contact with them. And I highlighted, you've got all the information, the ward number, the patient name, the named nurse. Please, can you just make contact with the hospital? And again, they refused and stated it was written in their contract that they were not allowed to make contact with the hospital. So myself and my sister had to stay with my father throughout the weekend. And it highlighted that this posed a number of risks. My father was offered fish when he had a fish allergy. They tried to make changes to his medication when it was already noted that medication made him poorly. It highlighted that a deaf patient in hospital without communication support posed a number of risks. Again, we submitted another complaint to the hospital and submitted a freedom of information request asking if this was correct. Is it in your contract that DA Languages are not allowed to contact you even though they know a deaf patient is there? The hospital did their investigations and found this to be untrue. DA Languages are allowed to contact hospitals. They are allowed to take patient information and start that process of looking for an interpreter. And this, on many occasions, DA Languages didn't provide interpreters. We are very lucky in our area now that Merseyside have made many changes to the contracting and now contract to specialist deaf agencies. About 10 years ago, the NHS brought in a procurement framework, and it saw many spoken language agencies, like DA Languages, take over specialist deaf agency provision. But from then on, provision has been very poor, and the deaf experience of accessing healthcare has been very poor. Hospitals don't know about this because hospitals themselves do not have accessible complaints policies, because their complaints policies are not translated into BSL, and deaf BSL users cannot make complaints. So that's our experiences, and I'm going to share more information in further clips. Thanks for watching. So I have a message to deaf families, and that is complain. You have to make complaints. and it has to be formal complaints. And I'll give you an example as to why. In the Merseyside area, we have done a lot of work with Healthwatch or PALS, and they set up consultation events, which were deaf accessible events. The deaf community attended those and shared all their experiences and what access to healthcare was like in our area, which was really poor. But when you look at the statistics, there was only 5 official complaints made to the trust. And we all know why. We know it's because the hospital's complaints procedures are not accessible. But 5 of those complaints, 2 of those being from our family, were only official complaints, which means the higher up people in the hospital, the management, are not aware of the access issues deaf people are having when trying to access healthcare. So you do need to make official formal complaints. Again, a lot of hospitals' complaints procedures are not accessible, but under the accessible information standards, it means you have a legal right to film yourself in BSL, talk about your issues, give them your name and so on. Take that video and send it to the hospital. The hospital have a legal duty that they must respond to you in British Sign Language, and that is an accessible way for deaf people to make complaints. Thanks for watching. This is a message for commissioners and hospital trusts. I want you to ask yourself a question. Think about your complaints policy. Is that policy translated into British Sign Language? Is that video somewhere that's accessible for the deaf community to view and understand? Do you have the facility for a deaf patient to film themselves in BSL, to send you a complaint, and you respond in BSL in a timely manner according to your policies? If your answer is no, then you have no idea of the lived experiences that deaf patients and their families are experiencing within your hospital trust. Over 10 years ago, the NHS introduced a procurement framework. Prior to that framework, deaf provision was provided by Deaf Specialist Services. When that framework was introduced with the aim of reducing interpreting costs, spoken language agencies identified that there was a way of profiting, and deaf people became a commodity. We, the deaf community, are sick of it. We're sick of being used for financial gain. Please start monitoring your contracts properly. And by this, I mean ask. Ask if bookings are not met. What percentage of those bookings are for deaf people? Are those spoken language agencies accessible for deaf people to contact? Is there accessible way for deaf people to make contact with them, to make inquiries about their health bookings? Does that agency follow the accessible information standards? Have you included a mandatory adherence to the AIS within your subcontracting? Do you have deaf representatives when you're commissioning deaf services? Have you read the NHS Public Health England guidance for commissioning services for translation? Because within this, they talk about the need to separate contracts between deaf and spoken language agency interpreting. Deaf provision is a legal duty, spoken language is not, and this should be recognised when you are commissioning. I could go on and on and on and tell you more, but please, what I'm asking you to do is engage with your local deaf community. Go to your local deaf services, set up a deaf accessible event and find out for yourselves what the lived experiences are for patients in your area and ask them to recommend how they should make changes. Thanks for watching.